I'm here with Ms Susan Pearce, who is Deputy Secretary at the Ministry of Health. Just wanted to provide you with an update of the numbers for COVID-19. First of all, immunisation. We're seeing pleasing levels with 78.8% of people 16 years and over who have been vaccinated now in New South Wales with 1 dose and 46.5% with 2 doses. We've had 8.2 million vaccines delivered in New South Wales, including 3 million from New South Wales Health. These are great numbers and serving us well to help combat this pandemic. In terms of numbers of cases, there were 1,127 locally acquired cases of COVID reported in the 24 hours to last night in New South Wales. There were 8 overseas acquired cases in the same period and 1 case acquired in Victoria. There were 114,084 COVID tests reported to 8 o'clock last night, compared to the previous day of 137,668. In terms of hospitalisations, there are currently 1,253 patients with COVID-19 admitted to hospital in New South Wales, with 231 people in intensive care and 104 who require ventilation. Sadly, there's been 2 deaths from people with COVID reported yesterday. A woman in her 80s from Western Sydney who died at Ryde Hospital. She'd received 1 dose of COVID vaccine and had underlying health conditions. And a man in his 50s from Western Sydney who died at Concord Hospital. He'd received 1 dose of COVID vaccine, but just 3 days before being tested positive for COVID. And he did not have underlying conditions. We extend our sincere sympathies for the loved ones and friends of these 2 people who have sadly died. There have been 186 COVID-related deaths in New South Wales since the 16th of June and 242 since the start of the pandemic. We've had some further sewage detections as part of our ongoing sewage surveillance program in New South Wales, including at Young, where we have no known cases. Young is in the Murrumbidgee Local Health District. There's been no cases reported in Young, so we're just urging everybody in that community or have been in that community to come forward for testing with even the mildest of symptoms. So if there are cases there in the community, we can identify those quickly. Within Sydney, there are cases continue to be primarily at highest rates in western and southwestern Sydney, although throughout the greater Sydney and regions we are seeing cases, of course. But the suburbs with the highest numbers of cases continue to be around Auburn, Greenacre, Bankstown, Liverpool, Merrylands, Punchbowl, Riverwood, Yagoona, Condell Park and St Clair. In terms of regional cases, we're seeing in Western New South Wales there have been 14 new cases of COVID reported to 8 o'clock last night, bringing the total number in the LHD to 992. In Far West, 5 cases were reported to 8 o'clock last night, including 1 in Broken Hill and 4 in Wilcannia, bringing the total number of cases in Far West to 167. In Illawarra, we saw a jump in cases over the weekend, but 17 cases reported for yesterday, bringing the total number of cases there to 412 for the outbreak. In the Hunter, 14 new cases were identified to 8 o'clock last night, bringing their total to 324. The Central Coast, 9 new cases were identified, bringing their total to 278. And in southern New South Wales, 4 new cases were reported, bringing their total to 27, including a case in Yass. Yesterday, an announcement was made that to protect the people in New South Wales from COVID-19, that new restrictions were introduced to the Yass Valley Council from 12:01 a.m. today for 2 weeks. This follows the identification of a COVID-19 case in the area following a recent positive sewage detection. Further investigations are underway. The stay-at-home orders will apply to all people who live in the Yass Valley Council area or have been there on or after the Thursday, the 9th of September. Everyone in these areas must stay at home unless it's for an essential reason. So we're seeing cases, it's too early to know if we're flattening the curve, but we're seeing pleasingly so far that cases haven't been increasing as fast as they have been, but there may be an effect of the weekend. We'll look to see what's happening throughout the rest of this week to know how we're going. But it's really pleasing to see immunisation rates increasing so quickly. Cumberland, which has been a particular hardest hit area in Western New South Wales, has seen a rapid increase in immunisation rates in the last few weeks. And we're thinking that's probably been one of the reasons we have seen in recent days a flattening of the curve there. Now, while it's too early to say, it's certainly very encouraging. I think provides a good message to the rest of us across the state. Immunisation is the key to getting out of this outbreak. So please come forward for immunisation across the state, but particularly in those areas of concern. Very important, get immunised. Tell your family and friends, encourage them to get immunised as well. Thanks very much.
Jeremy, yesterday you told us that you're now restricting contact tracing to specific areas like aged care, prisons, schools, those kind of places where the concentration of cases can happen, effectively kind of giving away some of the broader, because of the numbers, broader contact tracing you've been doing. Is there any point in us still doing the QR code check-in system?
Yeah, look, we are prioritising contact tracing to those areas that we are most concerned about, and that continues to be in regional areas, in places we know are high risk for transmission in certain workplaces, and in places where people congregate, such as aged care facilities, group homes, and places where we know there's been transmission. So QR codes remain a really important part of that, to identify people who fit in those categories, and also when we identify locations where there has been transmission over and above those areas, to make sure we get onto those cases, those contacts.
The curfew is still in place, obviously, in the 12 local government areas of concern. What's the health advice, or what's the evidence that that is proving effective, given that you've got places like South Africa, which is relaxing their curfew? I mean, they're up to nearly 4,000 cases a day. This is something that's happening around the world in terms of relaxing that. Why aren't we seeing that in those 12 local government areas of concern?
So there's a suite of measures that are put in place across New South Wales, depending on the incidence of disease and other factors. And those suite of measures include a range of activities, including in some areas curfew. Now, the government's continually to review those measures based on the numbers and how they're trending, and other factors like immunisation. So that's been part of the suite of things, but that's under constant review.
Dr. McAnulty, what is the rate of reproduction now? Has it at all dropped?
It's a little bit early to know, because we do like to see, as I mentioned, we've just had a weekend that can mess up with how many people get tested. That there may be a factor of the weather in terms of influencing whether people get tested or not. So we'd like to see a few more days before we can have confidence about whether there is a trend. We have seen in the past, 3 days of flattening and then it jumps up again. So we need to be cautious in drawing any.
So what's it sitting at now, though? Do you have an approximate?
So it has been a little bit over 1, and that's why we've seen 1.2. That's why we've seen cases increasing. But when it gets to 1, that means it's flattening, and when it gets below 1, that means it's declining. So it depends on where you are in the state. So in some states where we've seen increases, such as in the Illawarra and Central Coast in several days ago, it was certainly above 1, but where we're seeing a decline, it falls below 1.
Dr. McAnulty, I asked the Premier about pools yesterday. She said pools is in relation to health advice, says they can't reopen, but from a health advice perspective, is there any difference in COVID risk from a public pool and a natural swimming pool, like an ocean pool, compared with a public pool?
Yeah, so pools, first of all, recreation, exercise is good for people. Being outside is good for people. But we need to make sure that we're limiting congregation in areas. So certainly in the western, southwest Sydney, where we've been seeing the bulk of cases, minimising congregation of people even outdoors is important. And man-made pools council pools are places where you pay to go in, you have change rooms, you have places where you encourage congregation, whereas many natural pools don't have that. And certainly on the coastline so far we've had lower rates of disease. So all those kind of factors are taken into account when deciding whether or not it's safe to open any sort of facility like a pool.
But what about, sorry, just to follow up, but in relation to the actual difference between a natural swimming pool and a public swimming pool, is there any difference, or is it about the caseload?
So in terms of COVID risk, it's not about if it's a natural pool or not. It's more about the facilities that surround that, how you get into the pool, whether you're likely to congregate around that pool, and I guess where the pool is as well in terms of likelihood that people in the surrounding area may have COVID. So those are the kind of things that need to be considered when deciding whether or not to open a particular facility such as a pool.
Doctor, there's a lot of talk today.
Sorry, you first.
Of course, yes.
The Legislative Council in New South Wales is going to attempt to sit today. Has New South Wales Health approved the COVID safety plan for New South Wales Parliament, and would you be comfortable with that House setting?
Look, I'm not across that. I can't answer that question. I'm sorry.
Doctor, there's a lot of talk today about defining areas of concern by postcode or suburb rather than by LGA. Is there a health reason why we've been sticking with the LGAs rather than defining it by suburb?
So I guess, again, there's many factors to consider in these things, one of which is LGAs tend to be bigger, and people who live in suburbs which are smaller tend to need to travel across their LGA to go shopping, to do other activities. So again, this is all open to continued review, but one of the factors that makes it more practical to use an LGA level is the ability for people to move about to do essential activities within that LGA rather than a much smaller suburb.
Because obviously there are people who are living in suburbs where there are very small numbers of cases and have been during this entire outbreak, yet they are subject to further restrictions. What can you say to those people who feel that they are being treated unfairly?
So it's been important in this outbreak for us to focus on places where the risk is highest, and that's been where in those LGAs of concern. Now, the advantage of doing that is many. One includes focusing where testing is done, focusing people's awareness of risk, but importantly also focusing where we can prioritise immunisation, so that the LGAs of concern have allowed us to prioritise immunisation in those areas to ensure that we're getting ahead of this outbreak. Remember that immunisation is our ticket out of here, so the faster we can immunise people across the state, but particularly in those LGAs of concern, the better. And that example we talked about earlier of Cumberland appearing early days to be flattening in the light of rapidly increasing immunisation rates is an example of that, where just getting immunisation to arms is just so important.
And just a technical question, I'm sorry. If there is some suburbs are split, one half is in one LGA, one half's in another LGA. If there's a case in a particular suburb, how is that case allocated? So usually they're defined by postcode. How do you put it in one LGA or the other?
Yeah, so there are a few different methods, and it gets a bit technical beyond my ability to explain it, but one is by postcode, but more accurately it's about geocoding, so you can actually get the real place the person, LGA, the suburb is in. So, and those provide slightly different answers, but the best method is the geocoding method.
Just to follow on from that.
Sorry,
Dr. McAnulty. Just to follow on from that, the City of Sydney is obviously not...
Sorry,
the City of Sydney is not a local government area of concern at present. There are some suburbs within the City of Sydney that are recording quite high numbers of cases, like Redfern and Waterloo. Why has Health not recommended that they enter the sort of restrictions that, say, have happened in Penrith, where certain suburbs have been declared an area of concern?
Yeah, again, we look at this on a daily basis, and the team that does that looks at numbers of cases, but also other factors such as immunisation, movements in the communities, and so on. That's on a daily review, and that could change any time. So I'll leave that to the team who's doing that to make those assessments. But certainly, it's very much based on the health need to declare a place of area.
But just a follow up to that.
Yeah.
You guys. With the 12 LGAs, what are the specific triggers though? What does the 12 LGAs need to get to release that lockdown, to give them relief?
So there are a range of factors, and I can't tell you all of them because I'm not in that particular team that's looking at that. But it's essentially the numbers of cases, the trajectories, immunisation rates, levels of movements within those LGAs based on transport and other data there are. So it's a whole bunch of stuff that goes in there to get a sense of whether or not there's a trajectory going up and whether additional measures need to be put in place.
So your advice at this stage is staying locked down?
Well, it's reviewed every day. So we'll look at those factors on a daily basis.
Susan.
So go here and then go there. Sorry.
Susan, can we just ask you about the immunisation? So there are a couple of really standout suburbs in Sydney. Schofields and Edmondson Park have both got above 90% double dose vaccination rates. Do you know what the factors are in those particular areas? And also, obviously, we all strive to be like that.
Look, I think that the rates of vaccination across the LGAs, and you can see where we focused that Polish Pfizer over those 3 weeks. And again, 970,000 vaccines in 3 weeks by New South Wales Health during that period. What we're seeing now is the result of that. The work for us now, though, which is really important, is to make sure that within LGAs and even within particular suburbs that we're actually drilling right down into looking at areas. Yes, there are high rates, which is great, but we've got to focus now on where the rates are a little bit lower, and that's exactly the work that we're doing. And so while we continue with our mass vaccination centres and our clinics, we've got increasing numbers of mobile teams out now going to particular suburbs. And so, for example, recently southwestern Sydney's been out in the suburb of Claymore vaccinating that population. We look at the postcode data rather than just the LGA data, so we can really hone in and focus on that. I think that one of the things about vaccine that we've always known was that the more people who were vaccinated, the more people would get vaccinated because they're seeing that being vaccinated is safe and effective. And so all we can do ongoingly is encourage people to follow that lead and please continue to come out. We're obviously striving for that 80% double dose of the adult population. I think we can do a lot better than that, and I look forward to the day where we can report a much higher number.
Which areas of concern, just to follow up on that, are you particularly worried about in terms of lower immunisation rates?
The LGA of Parramatta is an area of focus for us with regard to their current vaccination rate. Most of the other LGAs have come up very significantly, and you must remember only a few short weeks ago we were talking about rates, first dose rates of in some cases less than 20%. We're now seeing those LGAs with rates above 70 and above 80% in terms of their first dose. So I think that that's quite remarkable. But look, there are particular areas, and it's not just, of course, in the LGAs of concern. We're looking more broadly than that, and also to rural and regional New South Wales, where we monitor the LGA vaccination data very carefully.
So all the recipients, Ms Pearce, that got the Polish Pfizer were waiting 8 weeks between doses, right? But now that we've got like the UK Pfizer coming on board, and I think the Pfizer from Singapore too, right? Can they bring forward that second dose, noting that they'll need to bring forward the big double vaccinated to get some freedoms?
The Polish Pfizer blitz that we conducted, as you know, had a longer time interval. That was in order for us to get all of those first doses into as many people as possible at the time, and we succeeded in doing that. What we continued to do during that period, though, was to keep vaccinating everybody who already had a booking. With respect to the UK Pfizer amount and also the Singapore amount, the amounts that we have received so far are not sufficient for us to do all of those second doses yet. So our information from the Commonwealth at the moment is that we can expect to receive more of our share, our per capita share, then broken down into the health department share in October, which will allow us to do all of those second doses. So at this stage, that remains on track to do as we said.
And on second dose rates, sorry Liz, on second dose rates, are you bringing forward, are you doing more second doses now? Are you reprioritising to do more second doses than more first doses, or are you still focusing on first doses?
The booking system takes care of itself in that respect. So when you make your first dose booking, you automatically book for your second dose, as you know. We did bring forward the time interval for the AstraZeneca vaccine in order to do that. We're very confident about October in terms of the numbers we will be doing. There'll be a very large number of second doses given in the month of October across our clinics, which will be reflective of what we've just done. We're also looking to offer to people, for example, who may have had their AstraZeneca dose in a clinic, perhaps not one of the New South Wales health clinics, but elsewhere, if they wish to bring their time interval forward and haven't been able to do that, we will be communicating that we may also be able to assist with doing that, to assist getting those second doses in.
Where are the vacant appointments today? Where can you front up and get a vaccine today?
Look, most of our clinics now, in particular for the AstraZeneca vaccine, are taking walk-in appointments. Kudos Bank Arena last week advertised that they would take walk-in appointments for AstraZeneca, so please come forward. We have a plentiful supply of that vaccine. As you know, the Pfizer vaccine continues to be heavily booked, and with the small amounts that we've received so far from that UK allotment, we've communicated with our districts over the weekend about the distribution of that right across the state, and in particular focusing on areas where we need to lift those first dose rates, and some of those are outside of Sydney.
We were talking about, just one more for Susan, if that's all right. We were talking about vulnerable people, right, like social housing and that kind of, those communities in Sydney yesterday. Do you have vaccination rates for some of those communities, like the very vulnerable people?
There's a thank you for that question, because it is so important. And we've said before that no one will be left behind in respect to this vaccine program. Right now, as we speak, we've got teams out across Sydney in particular, but also across our rural areas, vaccinating vulnerable groups of people, both in social housing, in all sorts of settings, and that work is really important and will continue. We look at it, as I said, at postcode level data, but within our local health districts, every single local health district in New South Wales has a plan about vaccinating its vulnerable population, and the people who work each and every day on the ground at the local health district level know exactly where their populations are, and so obviously we rely on them. And the partnership model, I think that is also critically important in this space. New South Wales Health has done, a wonderful job of contributing to this vaccine rollout since the 22nd of February. We are partnering with, in particular, Aboriginal Medical Services. So there's been work, for example, at the Redfern AMS with Sydney Local Health District. We've opened Kimberwali yesterday in Western Sydney, which is a partnership with the Aboriginal community there. We're working with the Department of Communities and Justice. We're working with primary health networks. So right across the state, I think those models will become increasingly important as the program continues to roll out. So while we continue to do large amounts of vaccines, as I said, we need to really focus in on those areas. We're committed to doing that, and that will continue.
Can I ask you a question?
Do you mind asking a couple?
Yeah, of course, mate.
In terms of a metric for those LGAs of concern, do you guys have a number of cases or REF or anything like that you're looking to achieve in those areas? In terms of those LGAs of concern, do you guys have a case number or a REF, a trajectory that you're looking for those areas to get to before they come out of lockdown, like a tangible number?
No, not as far as I'm aware. As I mentioned, I'm not on the particular team looking at that on a day-to-day basis, but it's a combination of factors that are looked at, not an absolute number.
Just on that, so what's the inverse? So what would it take for a local government area to be considered an area of concern? Because there must be some kind of health categories or criteria for that.
Well, again, it's a combination of factors, but remember that the advantage of being an area of concern is that we're prioritising vaccination for those people. So it's really important that we get on top of this epidemic by getting as many people as we can vaccinated. So being an area of concern has advantages as well as limitations for people being there, but for good reason. So we can make sure that we're minimising movements within those particular areas, that we're seeing particularly high rates of cases, but also to maximise immunisation rates.
Dr. McAnulty, sorry, can I ask you a question? Dr. McAnulty, in terms of the REF, you mentioned there a REF to the Illawarra. Can you release those publicly, those REF by LGAs? Or?
Look, they were my estimates based on what we're seeing as a general feeling, where we're seeing generally the principle being when we're seeing an increase in cases, that indicates that on average, one case is infecting more than another case, so that's when the ref goes above one.
Are you modelling the refs by LGA? Are you at least modelling that?
Modelling, again, we rely on some experts to do the modelling, which I'm not one, but essentially you need a big enough population to be able to make reasonable. If you get too small population figures, it becomes a bit meaningless, and as well as if you use too short a period to make draw conclusions from it. So you've got to have robust data to be meaningful. And models provide guidance, but not the truth of what will happen, and that's why it's important that we look at a range of things.
Follow up to the modelling issue, Doctor. This morning you might have seen reports of a new group of top scientists come together calling themselves OzSage, who are making far more dire predictions about what's going to happen to our hospitalisations and our ICU numbers, saying ICU wards will be full over Christmas for some 5 weeks. A very different modelling to the Burnett modelling that you've been basing the plans on, the government's been basing its plans on. Are you concerned about their numbers? Are you going to stick with the Burnett models, or are you going to look at other models to adapt that plan as we go forward?
Yeah, I haven't seen those numbers myself. However, the team that does look at the modelling looks at all inputs. So there's a range, as you said, there's a range of different models that have been done. We look at those, we look at the robustness of them, the assumptions that are being made, and as time goes by, we can fit the real data to what the model data show. So we're doing that again on a regular basis. We've got teams of experts looking at that, talking with the modellers, making sure we're understanding where the trajectories are going.
Can I just ask you, restaurants and cafe owners, some of them appear to be copping some heat for telling their customers that they'll only be accepting fully vaccinated diners when they've reopened. I'm not asking you to weigh into the debate, but from a health perspective, can you just tell us what the health benefits are, if there are any, of having indoor diners fully vaccinated?
Look, as we've said all along, vaccination is key to controlling this outbreak. We know that vaccination provides good protection from people getting infected and great protection from getting serious disease. As well as, if you're vaccinated and happen to come down with the disease, it reduces your likelihood that you'll spread it to other people. So being fully vaccinated is very important for all of us. It protects ourselves from getting severe disease, and importantly, it protects us from spreading the disease to our loved ones or other customers at businesses.
In restaurants, though, specifically, though, when people are taking masks off and dining, are there additional reasons why it's helpful in restaurants and cafes?
Well, it's about protecting the individuals, protecting the staff, protecting yourself and the other diners from disease. Thanks very much, everyone.
Thank you.